Hello, my name is Emily Fontana, and I'm an occupational therapist and certified hand therapist in the Austin area. And today I'm just going to show you a series of thumb exercises, just basic range of motion. So here we have a thumb. This is obviously the palm side, and then this part right here is called the thenar eminence. And it's basically a saddle joint because it does all these cool little movement patterns, and thus it has to go through a lot of different movements in order to actually do everything that it does. So the first one I'm going to show you is a way to work on opposition. And like every other exercise that I show, you can start wherever you are. Always just check with your doctor to make sure that these exercises are, if you're post-operative especially, make sure that you are clear to do these first. And basically, what you're going to do is you're going to take this thumb and you're going to try to touch with your index finger. And then if that feels okay, you're going to move on to your middle finger, ring finger, small finger. Once you get to your small finger, what you're going to do is you're going to slide that thumb down, and then you're going to bend this joint right here. This is called your interphalangeal joint of your thumb. So you're going to pull that down as much as you can. Now, with active range of motion like this, you basically want to pull it down to the stage where it feels okay. You feel stretch, but it shouldn't be painful. So make sure you get to wherever that point is for you, and then just try to hold it for a few seconds. And then you're going to just reverse on out of there. You're going to go small finger, ring finger, middle finger, index finger. And if you want, you can also do a little slide on your index finger. Most people find that this is a little bit easier than when you're at your small finger because, of course, then you're not quite at full expression. You don't have to do as many things at one time. So that's opposition. So just one more time through, you're going to go index finger, middle finger, ring finger, small finger, and then you can start sliding your thumb down. And believe it or not, they even publish studies where they discuss how far down a person can get into these little palmar arches and creases that we see there. So it's really good to be able to do that, just kind of keep that thumb flexibility going. So as we were talking about before, this is a saddle joint. This is your metacarpal phalangeal joint. It's actually a hinge joint. And what you're going to do here is you're going to put your hand around the little saddle and you're just going to try to bend only that MP joint, which is the metacarpal phalangeal joint, and then you're going to straighten it all the way back out. It's always good to go through the full range of motion if you can and you're permitted to do so, because you really need to get the same amount of extension as flexion. So if you're only working on one position, like let's say you're only working on flexion, people are very surprised to see that they cannot straighten out all the way. So just make sure you go through the full range of motion, especially with these hinge joints. And then we're going to come down. So this is your IP joint or your interphalangeal joint, and you're going to kind of wrap your other hand around that. And that just helps you find the tendons that do that motion, and you're just going to bend it over and then straighten. And that'll help you get each joint individually moving. So if you're having a little bit of pain in one joint, this is a great way to get some mobility without having to do everything at one time. Like anything with therapy, a lot of times what we're doing is we're breaking things down into smaller segments to make it easier so that you can start moving. And then, of course, there's composite motion of your thumb, which is where you bend everything at once. So you can see this is obviously going to be a lot harder than the last ones that I've shown you. So then, again, you see you have your little crease here. And again, remember, those are sometimes measured in studies, like how far down people can get on their different little creases and stuff in their hands. So always good to be able to do these, but just remember, if you go all the way down here, make sure you go all the way back out. And then speaking of this position, we also do abduction. So when you grab something, this is called palmar abduction. So let's say I'm going to reach down and grab my phone, which is sitting here. I'm going to use palmar abduction, right? But we also have radial abduction. So radial abduction is going to be straight out to the side. So sometimes when you're talking to someone, let's say you're in hand therapy or your hand surgeon or your regular doctor told you need to work on both radial and palmar abduction, this is what they mean. So radial is this direction, and then palmar would be more this direction. And same thing there, you can work on just full range of motion, whatever that is for you. It doesn't have to obviously be perfect. It's going to be different for everyone. And you're just going to open as much as you can in this position and then close. And then you're going to flip it. And then it's kind of this way you can probably see the best. It's kind of nice to be able to go this way too, so that your thumb is coming closer and farther from your index finger. Radial abduction. And then the other thing about the thumb is because They're all extrinsic muscles. I mean, there are some intrinsics right here, but most of them are extrinsic, honestly, that do most of the movements that we're trying to do with our thumb, and thus everything crosses the wrist. So it's also important to cross the wrist. It will also help your thumb and fingers. So another great one, of course, is a prayer stretch. And this will stretch out all those flexors for you. Whenever you do a prayer, you want to start up, you can start up high, and then you can get down as holy as you can stand, so to speak. Again, remember, if you're not all the way down here at first, that's completely fine and probably quite normal. When you do get to whatever your full range of motion is without pain, you're going to hold that for about 10 seconds if you can. And then you're going to go ahead and relax, and you can repeat that as much as you can. Like maybe try to see if you can do 10 of them at a time. A lot of times they tell you in hand world to just do like 3 to 5 repetitions several times a day. But I know sometimes that's just a little hard, like you're doing other things. So if you're already there and you can handle it, just try to do like 10. And then you can maybe skip a few of the other ones, but don't tell your hand therapist that I said that. So there you go. Nice little prayer stretch. And then the other one you can do is just the opposite of that, which is a reverse prayer. So this one, it's a little bit more confusing looking, but you're basically going to line everything up to where your wrists are facing in like that. And then you're going to just hold that position. You can also remember when you were a kid and you did that, like, here comes the church and here comes the steeple, and then look inside and see all the people. You can kind of do something like that too. That kind of helps you a little bit. Remember this position. So it's just the little church and the steeple people, but then just flip it around like that. And then that will stretch the extensor side, which is like the back side of your arm, because some of those thumb tendons are actually way up here by your elbow. So this helps them stretch all the way out. And those are just a few ideas of thumb mobility exercises. But remember, don't ever really do stuff that you're finding on some random YouTube video until you've discussed it with your doctor. Thank you and have a great day.